Starting your 2 minutes time. Another page is there.
This one. Ma'am, next page, ma'am. That's all, ma'am.
Yes.
To the first page, ma'am. Shall I start, ma'am?
Yes, start now.
Hello, I am Dr.
Hi.
Manikam, one of the doctors in the antenatal clinic today. May I check your name and age, please?
Yeah, I'm Mary Good night, doctor, and I'm 32-year-old.
How you want to be called?
Mary is fine, doctor.
Mary. I'm sorry that my consultant is away. She has been called away at short notice, so she's not available now. May I continue the consultation on behalf of my consultant?
Oh, yeah, it's okay, doctor. I hope you are aware about my case detail.
Yeah, yeah. I have gone through your GP's letter. Mm, Do you have
Yes.
can you tell any other concerns you have got today?
No, doctor, I just wanted to know my laboring options and preferably possible. I will be keen to have C-section.
Okay. Before talking about your options of delivery and all, shall I ask you a few questions to know more about your present pregnancy as well as the previous delivery? Then we'll have a discussion and regarding your management options. Is it okay for you,
Yeah, doctor.
Mary? So far, how is this pregnancy?
Actually, this is my second pregnancy. This is a
Mhm.
planned pregnancy.
Mhm.
Everything so far as is normal. Nothing to worry, doctor. Even my baby is kicking out very well.
So good to hear. Are you able to feel the movement of the baby?
Yeah, yeah, yeah. My baby is
Have,
kicking very well. Yeah, very
have you
happily.
named the baby?
Yeah, he's John.
Very good. Okay. Do you have any pain in the tummy or uh,
No?
loss of fluid? Nothing. Okay. Mhm. So your all the tests so far done, everything is fine during this pregnancy.
Yes.
So about your previous delivery, can you tell me more about that?
Yeah, doctor. Actually, that was a horrible experience as far as the labor is concerned. I had overdue and I was not in labor, so they had admitted me
Oh,
and they had induced me with three pessaries. Okay.
oh,
And after the third pessary, I quickly went into labor. They thought, no, I am just making it hush hush and I'm just making it quite obvious, but I was paining a lot. They
okay.
gave me some pain relief, some sedation, some pethidine. I was zonked, but suddenly I don't remember that within a short period of time, my baby's heartbeat was dropping, and that's the reason they had decided to apply the forceps, a vacuum actually.
Okay.
And after that, I just briefly remember that there was some tear. They sutured it into the theater. After that, it was very. difficult time because I had to bear this pain for a long time. Then I was having some initially some difficulty in controlling my loose stool and flatters. Now, as of now, I do not have any
You are
concern.
having, okay. I'm really very sorry about your experience and the pain you have had at that time, and the treatment which was you received was not up to your expectation. I'm really sorry for that, and now we are symptom free. That I'm happy about it. And how about the baby? Uh, the baby is fine. Your first baby.
Yes, yes,
Okay.
yes, yes. My daughter is fine.
Okay. Do you have good support in the family?
Yeah.
Okay. So you had a tear and extending to the back passage. So that was the
Yes.
real worry. Because of that, you want to have a cesarean section. Is it so?
Yes, doctor.
Okay. Your concerns are valid. And anyway, may I know your future expectation of fertility options?
I will be happy to have two more babies, doctor.
Okay. Uh, do you have any allergies,
No,
any medical conditions,
no,
or any surgeries? Okay. Do you
no,
have any habit of smoking,
no,
alcohol, any
no.
recreational drugs? Okay. Your weight to height ratio?
Normal.
Okay. So your blood group?
I think it's A positive.
Okay. Any reservation for transfusion?
No.
Okay. So now we are going to. Have you taken any recent ultrasound scan?
No, doctor. Actually, this is a low risk pregnancy, so as of now, everything is normal.
Okay.
They had not offered me any scan.
Do you want to add anything?
No, thank you.
Okay. Thank you for the information you have provided. I want to examine you in the presence of Shapen with your consent. And so, as of now, everything is fine. And now you have two options. As you are willing to have a cesarean section, I want to explain about the cesarean section also. Uh, the cesarean section is a surgical procedure. It will be, you will not have that's I mean experience any pain. You will be under the effect of pain relief. That is the anesthesia will be given to you, and the delivery will happen easily without any problem. And but you will have a prolonged recovery. And there is some for any surgery there is a risk of injury to the bowel, bladder, and blood vessels, and there's a risk of infection, risk of bleeding. Some may even develop some uh, clot formation. So many complications are there, and um, but there won't be any pain, and there is no risk of any tear happening again. And the further pregnancies, in the future pregnancies, there is a risk of the uh, afterbirth lying at the bottom, leading to bleeding or heavy bleeding after delivery. All this can happen, and some may even get the afterbirth adherent or being very much attached to the scar. This can also happen. I'm not scaring you, just I'm telling about the possibilities. Are you with me?
Okay.
Maybe?
Yeah, doctor. Yeah,
Okay.
yeah, quite clear.
Yeah. Yeah. And but the recovery will be little longer. And whereas the normal delivery, if you, as you had already normal delivery with the use of this vacuum, even then, the chance of normal delivery is more this time also, as this is a second delivery, and the chance of the tear happening is also less in the second delivery. Usually, it is 7 in 100 women may develop this, and you had some pain relief which was not adequate, it seems, and so and it was a labor which was done after this injection medications also. That can also be a reason, and as your first pregnancy, this tear can happen. But this can be prevented by so many techniques. Shall I tell you more about this?
Yeah, doctor, it's okay. You can tell
Yeah.
me.
Now you are 36 weeks. From now on, you can have the massage with the vitamin E oil or some vegetable oil application over the lower part of the vagina and the perineum, and in a U-shaped manner, the two thumbs over the lower aspect of the vagina. You can have a pressure, give a pressure with the help of your partner also. This can be kept for 2-3 minutes. You can repeat it so many times. This will stretch the lower part, so the chance of tear happening will be minimized. Am I clear so far?
Okay.
And during labor also, when you are in the active second stage, that is when the neck of the womb is fully open, and when the baby is being delivered, even descending down, the specialized midwife will be taking care of you, one-to-one care, and adequate pain relief will be provided. Do not worry. You'll be offered injection on the back and adequate pain relief, one-to-one care, baby monitoring, everything in the labor monitoring, everything will be done. And she will be giving some warm compression over the area between the front and back passage that we call as perineum. Am I clear so far? So that will,
Okay.
these also will reduce the uh, incidence of this tear happening. And when the head is being delivered, the experienced midwife will give pressure to that area between the front and back passage, and the left hand will be controlling the delivery of the head, so that the head will not suddenly descend down, stretching that area. So it will be in a controlled fashion, it will be delivered, and this will also reduce the incidence of injury. This we call as hands-on method. Am I clear? Or the perineal support. Am I clear so far?
Okay. Yeah, quite clear, doctor.
Yeah, so these methods can be followed. Only in 7 in 100 women may develop small tears. If small tears happen, may be sutured, and sometimes if necessary, if the delivery of the head requires a cut, it may be given. That also can be sutured. So you can think over all these points also. And I will give you the patient information leaflet also. You can go through regarding the tears and how to prevent all these techniques also. And I'll write back to your GP and I'll arrange an appointment with the consultant. Do you have any more questions, Mary?
No, doctor, that's it. Thank you.
Okay,
Can
thank
you
you.
just share some leaflet, written leaflet?
Yeah, the leaflets regarding the tears happening and the treatment, how to prevent this, everything I will be sharing with you. And if you have any more questions, you can come back at any time. And if you have any pain or any discharge at any time, 24/7 number, contact number will be given to you. You can approach us at any time. Thank you, Mary, for your time. Ma'am, I have taken more time, ma'am.
Just last 1 minute.
Sorry, ma'am.
Last 1 minute.
I'm sorry, ma'am.
Okay. Your own reflection, then we will go through the detail.
Ma'am, I wanted to um, I asked about the open question. My agenda, I was afraid that I may not be able to complete in time, so I shortened the agenda.
So it's
And I
okay,
did.
dear. So shortening agenda is not a problem. You just
Okay.
need to take a permission for consultation.
Yes, ma'am.
That's all. What means? What is agenda? Okay. So
Mm.
for the new joinee, I just wanted to tell you,
Mm.
uh, you have to introduce yourself. You
Mm.
have to be aware situationally where
Mm.
exactly you are,
Mm.
what is the situation, any particular thing. So in this case, if you will see a situation, if
Okay.
you wanted to say the consultant is absent,
Mm.
okay,
Mm.
and the
Uh,
patient you are about to see is 32 weeks scientist they had mentioned, okay. So
mm.
some detail about the patient they had mentioned, so you should not be
Mm.
asking that question, okay. And then the referral note is there.
Mm.
uh, she has just moved to the area, so you can take this as an additional information.
Yes, ma'am.
Okay, so these three things, and if there is a lay, so do you find this? Are you getting adjusted to the new place? Something like that you can inquire if the
Yes.
lay will be there.
Mm.
Otherwise, nothing, no need of that question if it is a straight station. That is
And
my
I forgot to,
situation.
yes, ma'am.
This is
And I
my
forgot
situation.
to refer to the notes, delivery notes, ma'am.
Yes, you forgot to access
Mm.
the delivery notes. So
Yes,
that is
ma'am.
my situation. Aim is
Mm.
for what we are seeing this patient. So in this case, we are seeing this patient to discuss her mode of delivery.
Mm.
Hmm?
Yes, ma'am. Mm.
So short aim. Your aim should be very short. That we are here to discuss a aim of discuss on the behalf of my consultant. We are going to discuss the options of labor in your case. or options of delivery in your case. That's it. Because you had 4-degree perineal tear. Very important, very important that you need to ask. That is aim. And setting agenda should be. So let's continue. Can I ask you a few questions so that I can guide your concerns in appropriate way? Ask the concerns and then history information gathering. Okay, this way you can go. Keep it very short. So this introduction, situational awareness, aim, and setting agenda concern. It should not be more than 50 seconds. Not at all more than 50 seconds. From now onwards, see to it that your 50-second time should be sufficient enough to compile all these 4-5 questions. Okay. Keep a tab on your time and then go through the history. Okay, ma'am. So
Thank you.
your setting agenda was perfect for me. I was not expecting more than that. Now coming to the next point.
And the cesarean section also about the benefits and pros and cons both I explained to her. And but when I was explaining about the normal delivery, I forgot to mention that it will be a quicker recovery. That I forgot to tell her. But I told her how to prevent this happening. She was worried about the tear, so I explained the
Yeah.
methods how to.
Yes.
So I was concentrating on that, ma'am.
Okay. Yes. But still you had missed out on some points. Okay.
Mm.
Checking her background knowledge about 4-degree perineal tear, what it is.
Mm.
Okay, that is very important. What she
Okay.
knew. No, nobody debriefed me because I had been asked to come and see the consultant, but since it was my new baby, I couldn't able to
Oh,
attend.
okay.
Hmm?
But she told that she had some leak and everything
Now she's
subsided
not
now.
having. Now she's not
Mm.
having. Now she's
Yes.
relieved of all everything. Okay.
Yes.
Okay. Anything else you wanted to know?
Nothing, ma'am. Thank you, ma'am.
Okay. So my thing is same. Okay. So say setting agenda, aim, setting agenda. Why you had addressed very nicely because since I'm having this 4-degree perineal tear and I wanted to avoid, that's the reason I wanted to have a C-section. Okay, so very nicely you had addressed up in upcoming consultation. Then history taking was 5 minutes. The history was I feel was not relevant here was drugs. If the straight patient do not expect that it will be a means you do not need to ask this drug history to each and every patient.
Okay.
You can skip that question. Okay, you can skip this history. Only relevant where you think that the patient might be having, or there are certain situations like miscarriage, placenta abruption, to be very specific. IUDs, okay, IUDs. So in those cases, and obviously abuse, SRH module, where you think you can ask in those cases, okay. Uh, then you had asked me current history of present pregnancy. I don't know, understand. I told you in crystal clear way that everything is normal. Even my baby is kicking normally.
Okay.
Okay, so do
Mm.
not go in detail because I don't want you to spend much time
So
on that.
that will steal my time. Okay.
Yeah, so I don't want you to spend your time by asking whether there is any pain, whether there is any loss of
Mm.
fluid.
Mm.
Uh, okay, how is my baby's movement? Because I told you everything is
Everything
normal,
is fine. Okay.
including the
Mm.
report.
Yes.
Now, you do not require any blood group report. You do not require here any anomaly report. You do not require anything now. They do
Okay.
not repeat ultrasonography nearing term. Okay.
Okay.
Do not repeat. So far as they are not repeating ultrasound nearing term, the first and the last ultrasound the patient will be having will be at around 20 weeks.
Okay.
The repeat ultrasonography, if there will be any chances of SGA or any indication to have that ultrasonography. So always remember whether the baby is moving normally, that should be the only concern.
Mm.
I told you I am 36 weeks. So that is again, you lost a time here.
Mm.
Previous pregnancy detail. I told you everything in previous pregnancy because that is my instructions that I should be giving you all the information. Accessing case detail is one thing. Did someone debriefed you? Did someone discussed, explained you what kind of tear? No, nobody, because they had arranged a meeting, but I couldn't go because of my added responsibility. Okay, that question you missed out. Future fertility, very nicely you had asked me, very nicely. Then the relevant history was quite clear here. The only relevant history was not needed here was drugs, blood group, Jehovah examination. Okay, and this took almost 5 minutes. 1 minute you could have saved here again by skipping all this history. Okay. But after that, the channelization of the task was very nice. Positive enforcement regarding C-section, followed by why it is not a suitable option in her case. That is the negotiation. And then explaining the pros and cons of vaginal birth, the risk of repeat third or fourth degree tear will be there, but it is 5%. It is not 7% here. It is
Okay.
5%. Yeah, it is 5%. These numbers you need to know. Then uh, pros and cons of both the options. The chances of requiring instrumental delivery is less in her case. The chances of requiring episiotomy is very high to prevent this third and fourth degree perineal tear. But routine episiotomy is not recommended. That is the key. Okay, that is one point which you have to mention here. That is patient safety point. And then giving me time to decide, discuss with her partner and come back so that she can discuss all these options with consultant next in the next meeting. Giving her a specific patient information leaflet is very important, and perineal tear hub and all those things, or MASIC, these are the support groups. So please ensure that you will be having a knowledge of specific patient information leaflet. You can add website, NHS website details regarding your condition. That also you can say. Okay, means that is a web information
Listen,
regarding the condition.
ma'am, this consultant-led unit will be under the care of that also, I forgot to tell you.
Yes, she will be under the consultant-led care unit. Because the chances of labor. See, per se, I don't think she will be under consultant-led care unit because we have, yeah, a midwifery. Under midwifery also she can deliver. The only thing what we need to do here, dear, we need to be aware about that OSC care bundle plan. That is a buzzword here. Okay. So how you are going to minimize the risk of repeat tear. So with that, we can go ahead with. So most of the points you had covered. This way, the channelization was very nice. That positive enforcement regarding serious cesarean section, the disadvantages of cesarean section. This will not be a suitable option in means in general because of the risk associated with the with cesarean sections are more asymptomatic. So vaginal delivery can be a good option in her case, but it should be non-directional. It should not be directional counseling. So you were able to do a non-directional counseling so far as, and at least you had given me a crystal clear path what exactly I need to do. Okay, so overall a good station. So let's go through the answer key. Anybody's having any question? Shall we go through the answer key? No. Okay. So introduction, situational awareness, that is 4 degree tear, recently migrated, new area, and consultant absent. Okay, so there are multiple situations here. Setting agenda and aim. Okay, aim is to discuss for labor option. Agenda, gathered information. Okay, so from where you have gathered the information? From GP letter, previous difficult delivery, 36 week into your current pregnancy, and we are here to discuss the labor options. Okay, any specific concerns or expectation? Yes, I wanted to have cesarean section. I told you. So let's go through it. I would like to ask you a few questions, and then we will be guiding you accordingly. Question first. How is this pregnancy up till now? Okay. Only question, closed question if you want to ask. Fetal movement, naming baby. Any concerns in this pregnancy so far as? No, no concerns. Absolute low risk pregnancy. You can skip that naming baby also if you think that lay is not there. Okay. Fetal movement, you can ask lay examiner not there, then you can skip that naming baby. Any concerns so far as in this pregnancy? Yes, we had addressed that question. No. Okay. Details of previous birth, details of previous baby, how that baby is doing, and how many BBs you are wanted in future. Okay, so all these questions should come one by one, not at a time. Then acknowledge that, okay, I am really sorry you had a very difficult traumatic delivery last time. We will see to it that this kind of situation should not arise at this time. Okay, your birthing experience should be a pleasant this time. At least say something regarding your birthing experience. Birthing experience, we are saying, we are not saying that it is vaginal birth or cesarean birth. So we are saying a we will see to it that her birthing experience should be pleasant this time. Accessing case detail is one of the very important thing, dear. Any residual bowel or bladder symptoms, any leak, any flatus leak? No, I am having a very good control. I continued physiotherapy for significant time. Did you debriefed you? Okay, so did you debrief you? That was another question what I wanted to ask here. No, nobody debriefed me because I missed out on that. I missed out on that. Yeah, appointment. Social history, are you supported well? Smoking and drinking only you can say. Otherwise fit and healthy. Surgical history per se is not needed here because anyway, apart from that, we are not any other surgery. You can ask her. Apart from this suturing of the tear, any other surgery. Examination is not needed. No mental history, no trauma. Nothing is needed here. Okay. So medical, you can skip surgical history, smoking and alcohol history, and support is very important. Okay, that much history is very important. Max to max you can ask about BMI, but I will not score the marks on drugs, blood group, JOA, because she is second gravida, where the chances of requiring C-section is very less likely she will be needing a blood group, less likely she will be needing a JOA witness. Okay, blood group is specifically max to max. Okay, she's 36 weeks, you can say that way. If it is blood anti-D means blood group negative, anti-D, whether she received anti-D or not, you can inquire. But then JOA, very less likely she will be requiring any blood and blood products. Okay, so see to it your history should be very relevant and then go in detail. No examination needed here, just explain her what she had. So explain and draw. Check her knowledge, it is very very important. Okay, what is perineum? A area between your vagina and back passage. It is common to have some degree of degree of tear during labor. The chances of occurring tear is 9 out of 10 women can experience some sort of tear. Some are superficial, some are skin deep, and some are more deeper, that goes up to the anal canals and sometimes the lining of the rectum or anus. Hmm? And the muscles which controls the anal fibers or anal opening. So these tears are very less. The tears which a woman can experience is 6 in 100 women who are delivering for the first time. They may experience this kind of tear, and these tears are known as third or fourth degree tear. Yes, which I had explained in detail below also. The chances of having this tear will be 4 to 8 out of 100 women if we will use kiwi cup. And this is known as OACs. Actually, OAC, that means obstetric anal sphincter injury. So this is labeled as OAC. That is what exactly you have to explain her after checking her knowledge. Fourth degree tear, if the tear involves the skin, perineum, muscles of perineum, and extends deep to involve the muscles of anal control or anal opening and the inner lining of anus and rectum. It is known as fourth degree tear. What she has experienced. Please ensure you will draw here something. At least ulta means you can draw it. Means nobody is going to judge your drawing capacity. Nobody is going to judge, but then at least the examiner will be aware, oh yeah, she has made an attempt to make it more simplified. Okay, more simplified. So now you have to explain the implication of this third and fourth degree tear. The function of anal sphincter or opening is to have a good control over bowel function, and it is important that it is important to restore the structures which got torn during labor. So we need, and so we will have a very good control over flatus and fecus. This needs to be done under anesthesia in the OT so that optimum sterilization will be maintained, and you will be advised you will be given certain advice with antibiotics. Yes, this is what we have done it last time. Implications. I- in chances of most of the time this tear heals completely, okay, healed completely with no residual impact. But in future there might be a repeat risk of having this kind of tear, which is still lesser, that is 5 to 100, 5 to 5 out of 100. So 4 to 8 if she is having kiwi, and if she is having a vaginal birth, plain vaginal birth, then the chances are 5 into 100. So to avoid it completely, yes, cesarean section is an option to avoid it completely, because with vaginal birth the chances of having it is 5 out of 100. But there are certain negatives, there are certain positives what she can have with cesarean section. A planned procedure where she can decide a date and choose a time at 39 weeks of gestation. A date and time can be chosen by the patient. Planned procedure 39 weeks of gestation, at 39 weeks of gestation, but it's a surgery, so there will be a risk of anesthesia, risk of surgery like bleeding, injury to bowel, sometimes bladder. And if she delivered this time for with cesarean section, the chances of requiring repeat cesarean section will be 1 in 4 in the next pregnancy. Repeat risk of no scar may give up in the next pregnancy, that is 0.5 out of 100. Okay, that is 1 in 200. Then the third will be a risk of having a adherent placenta needing a torrent, may bleed torrentially. Okay, it is not that placenta previa will bleed. So needing they which may bleed, placenta previa might bleed next time. That is another option. And sometimes adherent placenta where removal of womb is an option. So these are the side effects of, or these are the uh, cons of having going ahead with C-section. Although it will minimizes or it will eliminate the risk of third or fourth degree tear, but the cons are very high, very high. And since she is very keen to have 4 babies, in her case, the chances of requiring repeat cesarean section will be very high. Along with that, it will be a surgery, so it will delay your recovery, it will delay your discharge, it will delay your bonding with your baby. Those are another problems. So to avoid this, even babies, what the babies who are born with this C-section are more prone for obesity and asthma, childhood asthma. On the other hand, the vaginal delivery is a natural process. If started on its own, there is a very good chances that you will deliver vaginally. The chances of needing instrumentation will be very less, because this is for the second time she is delivering. But yes, there will be a small risk of repeat perineal tear, that is 5 out of 100. So this pros and this cons you have to explain regarding the vaginal birth. But we cannot eliminate this tear totally, but there are measures what we can take it now onward to minimizes the risk of tear. So what next? A physiotherapy, perineal massage, physiotherapy from a physiotherapist. Okay, so guide her to a physiotherapist for physiotherapy. Then a self or partner can help her to perineal massage. She can use any oil, any means warm oil, and she can start massaging her perineum. You can explain, or a midwife can explain her and demonstrate her initially. Then she or her husband can do it for her. Following a OAC care bundle plan. What this OAC care bundle plan? It includes hands-on technique of birth and protecting the baby means mother's perineum while delivery of the baby's head. Episiotomy or cut will be considered in her case if there seems to be a chances of repeat tear, repeat third or fourth degree tear. But if but routinely we do not recommend episiotomy, as it doesn't minimizes the risk of OAC. Okay, so that another sentence which we have to mention here. Uh, no evidence suggests that it prophylactical episiotomy should be given to minimize the risk of third and fourth degree perineal tear. This sentence needs to be mentioned. Okay. Um, so all these, looking at all these things, um, you can choose what suits you better. But even though looking at the scenario, normal labor seems to be a reasonable option, where since she's not having any residual bowel symptoms and the chances of requiring instrumental delivery is very less if she goes in labor spontaneously. So she can go home night now. She can discuss with her partner. Till that time, I will be sharing with you patient information leaflet regarding perineal tears during childbirth, what you need to know during pregnancy, OAC care bundle information for expectant mother, care of a third and fourth degree tear. Now we will not be giving this third patient information leaflet because this is after third and fourth degree perineal tear. OAC care bundle information and perineal tear during childbirth, what you need to know during pregnancy. So these are the two PILs, and the support groups are RCOG perineal tear hub, MASIC, that is mothers and anal sphincter injury in childbirth, birth trauma, bowel and bladder community. So these are the support groups and documentation. So whatever we had discussed today, we will be documenting. I will be writing back to your GP. A next follow-up appointment with the consultant. By that time we can have a very crystal clear discussion, and then we can go ahead, whatever option suits you better, we can go ahead with that. Okay, so this way we are going to end the task, a simple task, but still we just mess up. Sometimes we do mess up a simple task. This do happen, dear. Okay, now coming to the domain wise scoring. Anybody wants to say anything? No, no active participant today, only sleeping participants. Okay, so domain-wise scoring, communication with patient, counseling a patient that what their preferred mode of delivery. So the counseling should be objective and non-directional manner. When it comes to be a non-directional, that means you are not going to force your decision on them. You are just going to let them or help them to do a proper choice. So that is non-directional, explaining pros and cons of both the options. Listen to her concerns and explain what the woman's options are in clear and plain language. Allow her to make an informed choice about how she would like to have this baby. Should be able to use the information to make her own choices rather than you will be telling her. Negotiation and compromise are key skills being tested. Practice agreeing plan rather than deciding for the patient. So, okay, at the end, you can just explain, ask her, so what are your thoughts? What have you decided? Okay, do you think that the vaginal labor will be a suitable option in your case? Okay, so this kind, you do not force your decision. No, it's your vaginal delivery only which you should opt, and nothing else. So this is totally a wrong approach. If you will be saying that vaginal delivery is the best option in your case and you should go for it, this is totally wrong. You are just going to say that the pros and cons of cesarean section, pros and cons of vaginal delivery. Here you can just use a sentence that in your case, since you are not having any residual bowel dysfunction, and your chances of delivering vaginally is pretty high, so vaginal delivery will be a suitable option since you are keen to have more babies in future. But still you can go home and you can read, you can get come here along with your husband after reading all the patient information leaflet and meeting a support group people. Okay, so they will able to allow you to take a decision. Applied clinical knowledge, we all know what the knowledge means. Okay, so compromise, reassurance and negotiation is a key area. Explaining that vaginal delivery is a very reasonable option as she has no residual bowel symptoms and there is a low chance of needing instrumental delivery. A certain fear and misconception and allaying that fear. Competent candidate will take into the account of her wishes of having a 4 children and balance the discussion of the risk of vaginal delivery with both the positive benefits of cesarean section on pelvic floor and risk of repeat subsequent cesarean section. Patient safety is counseling. So this is basically they were emphasizing on this point. Routine prophylactic episiotomy will not minimizes or there is no evidence to suggest use of prophylactic episiotomy to minimizes or to prevent the risk of third or fourth degree perineal tear. Risk of repeat cesarean section, explain her objectively, including intraoperative risks such as bowel bladder adhesions and morbidly adherent placenta, which she has explained me nicely. Pros and cons of vaginal and cesarean section, which also she has managed to explain me. Acknowledge patient's right to choose the mode of delivery. Yes, you have to give her all the options and let her choose what suits her better. Doctor's job is to tell her all the information she will be having so that she will make an informed choice. Finally, obtain details from the previous hospital which she has missed out, okay? Because that might affect our mode of delivery. Information regarding the current pregnancy, information regarding the previous pregnancy, accessing case detail, it's very important. Ascertain her current symptoms, her preferred mode of delivery, reasons behind it, including her long-term plan of having children. A focused, detailed history regarding the future fertility, because that will be a key decision maker regarding her option of vaginal or cesarean section. If she wanted to have only 2 kids, then okay, you can at least say that okay, these are the risks and these are the benefits. Both the options are equally suitable in your case. What with this thing, she can totally prevent with cesarean section, she can totally prevent the risk of repeat cesarean section. If she is not going for any next pregnancy, scar dehiscence, if she's not going for any future pregnancy, and at the same time she can totally eliminate the risk of third and fourth degree perineal tear. Okay, so with this you can with this way you can explain, and with this way you can counsel this patient. So this information is very important. So that's it so far as. Anybody wants to say anything? No.
Yeah, it's okay, Doctor. Thank you.